Most of the factors, though, that really associate with Alzheimer's disease are avoidable. They're factors that you can intervene and make a change so they do not cause your brain to die too fast. So what do those include? Well, again, I like to use an acronym, FEP, food, exercise, and protection. Your brain is a living physical organ that works off of chemicals and electricity. Living physical organs need food, they need exercise, and they need protection. So therefore, the risk factors are the opposite of that. If you don't feed your brain well, it will die faster. What determines food to your brain? Blood flow and nutrients. Therefore, an unhealthy diet, particularly a high-fat diet, because it appears that fat is neurotoxic to the brain, just the fat itself is neurotoxic to the brain. High-fat, unhealthy diets cause your brain to die faster. Blood flow. All of the cardiovascular risk are associated with an increased risk of Alzheimer's disease. So everything that is good for your heart is good for your brain. This is becoming very, very clear. And it's interesting because most people know a lot about what's good for their heart. Well, now you know a lot in one area that's good for your brain. And therefore, everything that's bad for your heart is bad for your brain. It's things such as high blood pressure, high cholesterol, diabetes, obesity, smoking, all of those increase your risk of Alzheimer's disease. Why? For one reason, they block blood flow to the brain. That when you have coronary artery disease, your brain does not get as much blood. And your brain takes up about 25% of the blood flow in our body. Now, they also can be more directly neurotoxic in and of themselves. For example, smoking. Just the smoking itself is damaging the brain independent of the coronary artery disease. But just remember, everything that's bad for your heart is bad for your brain. If people just focused on changing those, they would significantly reduce their risk of Alzheimer's disease. Now, the other part of food is nutrients. So not only are bad diets bad for your brain, but nutritional deficiencies are bad for your brain. Almost every year, they come out with another vitamin deficiency that is associated with Alzheimer's disease. I've been an advocate of vitamins for 30 years. First of all, I don't think they can hurt. The data is not out there to prove that they help. So most doctors don't recommend them on a regular basis. As far as physicians, they like to see a study to prove that this vitamin is necessary. Well, they are coming out with studies that show people who are low on vitamin A, low on the B vitamins, vitamin C, vitamin D, all of those appear to increase your risk of Alzheimer's disease. So vitamin deficiencies, and we'll talk about later how to replace your need for vitamins, but vitamin deficiencies appear to be associated with an increased risk of Alzheimer's disease. And it's very simple. Anything your brain needs to live, nutritional-wise, if it doesn't get it, it dies faster. And one of the problems with proving this, and this is a problem with all the studies in Alzheimer's disease, most of the studies are done after people are really disabled or really sick. Now why? That's where the money is. What drug company's going to do a study on B12, which I get at Sam's, for $10 for 3 months? Who's going to do a study on that vitamin and see if it helps? They've done some simple studies, but they're not going to pay for it. It costs $100 million plus to bring a drug to the market for Alzheimer's disease. The other problem with proving the need for vitamins or vitamin deficiencies is that, again, the brain is dying over 40 to 60 years. Who's going to do a B12 vitamin study over 40 years? I can almost guarantee you if they did, they would find a positive outcome from that study.